everyone, it's Michael here at Home Health Success Academy and 10xpatientreferrals.com, and welcome to the last video of our presentation video series where we kind of work with you guys to give you guys what you need to do when you're in your presentation section of this whole thing, right? And so, pretty much in this last video, we want to be able to start talking about outcome, planning your outcome, because you need to start planning the outcome after you do your presentation. And during your presentation, you should actually have a call to action on what the next step is, right? So if you're able to start looking at that, you're gonna incorporate, outcome or call to actions throughout the video series. And actually, part of the outcome planning is really closing the deal, closing the sale, right? And you should have a bunch of closing techniques, closing scripts, and we actually have a closing script section in our training series where we share with you guys all the different closing techniques and closing scripts you should have. Now, just let you guys know, you might say something, well, Michael, I don't like scripts because scripts are really just, fake, and scripts are, doesn't sound original. Here's the thing, guys. Language is unoriginal, right? You learn the words from somebody else. Somebody else gave you scripts. Somebody else told you how to put, sentences together, paragraphs together. There is no difference between the scripts that we're giving you. We're just showing you guys scripts that you should actually be using throughout your presentation, right? Your objection handling scripts, your closing scripts. If you incorporate all that within your presentation, that right there is going to be able to justify and help you guys, move on. Like, I'll give you a quick example. Like, if I'm speaking to a physician, and I'm going to use a closing technique called the, referral close. Like, hey, doctor, before we even get started with this, with me telling you more about our company and how we can help you guys, do you think any other physicians out there might want to see and meet with us in our services as well? And by me asking that, they may say no, but what if they say yes? Now, all of a sudden, I have what they call a referral close, which then I can use him, suggesting another physician. I can go to that physician and say, hey, Dr. Kim recommended me to speak to you, right? That's called a referral close. So, you should have a bunch of different scripts ready, but the outcome close is really like you addressing like what the next step is. And so towards the end, you're going to ask the questions like, now that we're done with this presentation, tell you that you know more about us and how we can help you. I was just hoping to be able to figure out what would be the next step for us to be able to show that we provide great care. Are there any patients that we can kind of look into and help you out with, or is there any other question that you may have? The reason why we're in that discovery mode is we might try to find out that they are not really entertained yet. If they really are, if they really have patients, then, because obviously before you walked in, you should know that they have patients, right? Give me a second, I'm gonna cough right now. Excuse me. So anyways, the closing part is such an important thing. So if we really look into this part, is we need to know what's the next step. If they say something like, well, think about it, right there alone, it's an objection by itself. That means if somebody tells you at the end of a presentation, they'll think about it, they're not too sure about the next decision, then that means you may not have addressed something correctly. You may have missed something, and that right there is where you need to be able to improve on. And so, but also I'll tell you guys one thing right now, it's rarely that we do a presentation and, and we get the referral right away. Referrals really start coming after showing that you are wanting to create a relationship and follow-ups. But the presentation is an important, vital part. So you need to be able to figure out what the next step is. And you can say, hey, can I follow up in a week or so? Or can I follow up in a couple weeks? And by having that, and getting them to say, yeah, sure, of course, perfect. And so remember, if we talked about the prospecting, on the prospecting video series, because I'm assuming that if you're watching the presentation series, you should have watched our prospecting video series as well. So in our prospecting video series, for example, what we start talking about there is that you should have a game plan of visiting this, if you're going to visit 100 potential people, that means you're visiting 20 people every day, Monday to Friday, right? That hits 100 people, and you're going to visit those people every week. You're going to email them. You're going to leave them a voicemail every week, right? And those are important things. So that's 24 touches within a matter of 8-week span, okay? And so by you asking, hey, can we stop by next week? Sure, I'm just going to drop off some more information for you. So when you follow up every week, that's such an important thing. Now, here's the fun part. Just because you do a live presentation, that does not mean you're not going to do other presentations as well. So we talked about earlier, we're going to create our proof tools, making videos, making flyers. So what we're going to do is in our emails, we're going to follow up with videos, link to videos of our presentation about certain things, about the tools of that week. So if we're talking about our decision tree, one week we're going to drop off that decision tree with some tchotchkes, with some treats for them, and keep on going on. And most people, here's just to let you guys know also, a dream presentation is, I don't believe in what they call lunch and learns, where you're going to spend like $100 or so for food and feed them. I don't like that, right? Because just imagine, I would rather, like I said, we're going to visit them for 8 weeks straight, once a week, right? I would rather divide that $50 that I'm going to spend to them on that one day and divide that into 8 days and give them something every time I visit. Okay, so those are things that you need to be able to look at. But handling and having the right closing techniques, which is pretty much your next step, to be able to close them, to be able to have another meeting, to close them, to be able to give you a call and try with a new patient, whatever you need to do, you have to have closing scripts available. So that's important in order for you to be able to move on to the next phase. So you should be able to know what the next outcome is and to be able to figure that out. Because if you can't and you don't start plugging that in your presentation and wait towards the end, really, that's going to cause problems for you. And you don't want, in the end, to get the objections. You'd rather be able to face the objections up front and cancel all those out. So that's why we want to be able to know early on what are the potential objections that we're going to face before we even walk in, and at the very same time is to figure out the discovery phase of finding out what made them choose to work with other agencies, or what made them, what are things those agencies can improve on to provide better care for the patients and provide care for that potential referral source. So we need to have a clear, guided, and figure out what the outcome is of this presentation. We don't want to just all of a sudden do a presentation and say, thank you so much, we'll give you a call. Try to have a call to action. Hey, I'm going to stop by next week. Can I drop off something for you even if you're not here? Or hey, can I email you some more information later on? Hey, can I leave you a voicemail? Hey, can I reach out to you in LinkedIn? Hey, can I reach you out in Facebook? Whatever you need to do, you need to be able to create and move on to the next level of things. Like I said, it's rarely that you're going to start getting referrals the very first visit. It's about creating relationships, and it takes a lot of visits first to be able to create the relationships. I'll give you a quick example. I've had a physician that I've been visiting, I remember for the first 3 months every week, and never got him to start referring patients to me. And eventually, he went from what we call an A category potential, because he was averaging about 70 referrals a month for Medicare patients. And so he became a B client, and we were visiting him every 2 weeks for follow-ups. And so eventually, as it progressed, after 3 months again, he ended up going to the C list, which then became an every month visit, and then, or a touch. And then after that 3 months, I remember he became an every 2-monther, right? Because he just really got into the D list. He pretty much is failing our stuff, and it's not every time you're going to get success. And so eventually we were visiting him only every 2 months, just for a quick hi, hello. But we were still emailing him. We were still, sending him some direct messages as well in LinkedIn as well. And a year and a half later, just calls out of the blue and says he has 4 patients to refer. A year and a half later. Sometimes it takes that a little bit longer. But the truth is this, guys. You're going to win if you know how to market, how to present correctly, how to prospect correctly, and you actually put in the work. Most agencies out there are failing because they don't know how much value, how much work they need to put in. Most agencies out there are cheating and committing fraud because they want the easy money. Most agencies want to hire an experienced marketer already and have him bring his or her list of contacts into their agency because they're trying to make it easy for them. But here's the thing, if you can develop your own marketers, if you as a marketer starting off and you haven't done this and you're getting into an industry and you want to build yourself up and you actually do these things, you're going to be able to create success. And that's the main goal here with our companies, to be able to help you guys do the right thing, present the right way, prospect the right way, and develop and create successful agency from the ground up. All right, guys, so I hope you enjoyed this video series. It's all about the presentation, and I hope you enjoyed it. I'm sorry if I coughed a couple times in the whole training, but hey, it's hard just like talking, and I'm not those guys that just wants to edit it always. So anyways, I just want to say thank you. Always understand that Home Health Success Academy is here for you guys, and know that home health marketing is easy when you know what you're doing. we want to be able to invite you to our 10xpatientreferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. We would like to thank our sponsors of this video, and over here at 10xpatientreferrals.com, our goal is to provide you guys amazing information on every single one of our videos. So medicationreminderprogram.com provides daily medication reminders for your patients. They call your patients twice a day to remind them to take their medications. What happens is a top reason of hospitalization for senior citizens is not taking their medications. So this program allows you to be able to keep your patients and not lose any revenue, but at the very same time, it allows you to stand out when you are marketing to other referral sources because you're providing more services, more programs than the competition around you guys. The next thing we want to be able to share with you guys is they have 3 different packages available for you at this very moment. Choose which one works for you. If you're an agency that's just starting up and you have less than 10 patients, you can go with the silver plan. Or if you have 50 patients, you can go with the gold plan. Or if you have up to 100 patients, it is only the choice to use the platinum plan. But guess what? It's up to you which one works for you guys. For a cost of as little as 33 cents per patient a day, it is worth everything for you guys. The next thing is homecareansweringservice.com. It's an answering services for your agency. So if you want to be able to have us handle all the calls for you in the weekends or the off hours when your business office is closed, we can definitely do that. Or we can even answer your calls for you during the day as well. Allows you to be able to do everything for your company. So homecareansweringservice.com is your solution for answering your calls on a timely manner. Now, before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our Online Marketing Bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our Online Marketing Bootcamp training, so sign up for a limited time at 10xpatientreferrals.com